This morning I was asked to discuss about the role of double autologous stem cell transplantation in the novel agent era. This is an important issue, and this is still the matter of discussion. I presented the results of the second interim analysis of the EMN02 trial, which is up to date the largest academic trial so far conducted and aimed at comparing upfront transplant versus standard dose intensification therapy, and also as a second randomization consolidation versus no consolidation. But what is important is that in the design of the EMN02 trial, patients in centers with a double transplant policy were allowed to be randomized in the 1:1:1 ratio to receive either standard dose intensification therapy with VMP or single autologous stem cell transplantation or double autologous stem cell transplantation. So the primary study endpoint was to compare transplant versus no transplant, but single versus double transplant was a secondary study endpoint. And the results of the second interim analysis, which was reported at the AES meeting 2 years ago, showed that in the intention to treat population, progression-free survival and overall survival were significantly longer for patients randomized to receive a double versus a single autologous stem cell transplantation. In terms of progression-free survival, the progression-free survival benefit with double transplant was retained across many subgroups of patients at low and high risk, but the most remarkable improvement was seen in patients with a high-risk cytogenetic profile. For these patients, there is a meaningful 3-year estimated progression-free survival of approximately 70%, and also the overall survival was significantly prolonged with an approximately 50% reduction of the risk of death in comparison with the data seen in the single transplant group.